There is a phrase many people over 60 hear far too often. That's just part of getting older. It's said about fatigue, about joint pain, about memory lapses, about dizziness, about changes in mood or balance. Over time, you may start to believe that discomfort is simply the price of aging and that pushing through it is the only option. But here is what many doctors are now emphasizing. Aging itself is not a disease. While the body changes over time, it is not supposed to bring constant suffering, sudden confusion, extreme weakness, or unexplained weight loss. When those things happen, they are not just signs of another birthday, they are signals. The real danger is not the symptom itself. The danger is assuming it's normal and doing nothing. Today, we're going to walk through the symptoms medical professionals say should never be dismissed as just aging, explain what they may indicate, and help you understand when it's time to take action. Some of these signs are subtle. Others are easier to overlook than you might think. And there's a strong chance at least one will feel familiar. Persistent, unrelenting fatigue. Feeling slightly less energetic than you did at 40 is natural. However, feeling exhausted every single day, even after a full night's sleep, is not. When fatigue becomes overwhelming, when simple tasks like grocery shopping or making the bed feel unusually draining, that deserves attention. Persistent fatigue can be linked to thyroid disorders, anemia, heart disease, chronic infections, sleep apnea, or vitamin deficiencies such as low B12 or vitamin D. What makes fatigue tricky is that it develops gradually. You adjust. You slow down. You assume it's aging. But profound exhaustion is often your body's early alarm system. Sudden or worsening memory change. Occasionally forgetting where you placed your glasses happens at any age. But frequent confusion, struggling to follow conversations, getting lost in familiar areas, or noticeable personality changes are not typical aging patterns. Memory concerns can stem from medication side effects, depression, thyroid imbalances, dehydration, infections, or vitamin deficiencies. In some cases, they may signal early cognitive decline. The key word here is change. If memory shifts noticeably or rapidly, that is not something to ignore. Shortness of breath during mild activity. If you feel winded after intense exertion, that can be expected. But if walking across the room, climbing a few steps, or lying flat causes breathlessness, that is not simply age catching up. Shortness of breath can indicate heart disease, lung conditions, anemia, or fluid buildup. Especially if it appears suddenly or worsens over weeks, it requires evaluation. Breathing should not feel like effort during routine activities. Unexplained weight loss. Many people assume weight loss is positive, but losing weight without trying, particularly more than 5 to 10 pounds, can signal underlying issues. Unintentional weight loss may be linked to thyroid problems, digestive disorders, depression, chronic infection, or even certain cancers. When the body begins losing weight without changes in diet or activity, it is often responding to something internal. That change deserves investigation, not celebration. Numbness, tingling, or burning in hands and feet. This is commonly dismissed as poor circulation or just part of getting older. In reality, persistent numbness or tingling may signal nerve damage, diabetes, vitamin deficiencies, or spinal conditions. Nerve issues tend to progress if left untreated. Early detection can slow or even reverse some causes. Ignoring it allows potential damage to become permanent. Frequent falls or balance problems, a slight decrease in agility, is normal over time. However, repeated falls, sudden dizziness, or increasing instability are not expected aging outcomes. Balance issues may stem from inner ear disorders, blood pressure fluctuations, medication side effects, neurological conditions, or muscle weakness. Falls are one of the leading causes of injury among older adults, and many are preventable when the underlying cause is addressed. Persistent pain, that worsens or disrupts sleep. Mild stiffness in the morning can happen with age, but sharp, severe, or worsening pain, especially pain that wakes you at night, is not something to accept. Pain is the body's communication system. Chronic or intensifying pain may point to inflammation, arthritis progression, nerve compression, or other treatable conditions. When pain begins interfering with sleep or daily life, it is time to listen carefully. Why these symptoms get ignored: many seniors minimize symptoms because they don't want to seem dramatic. Others fear a serious diagnosis. Some believe nothing can be done anyway. But modern medicine has advanced significantly. Many conditions, when caught early, are manageable or reversible. Waiting often limits options. There is a difference between natural aging and pathology. Aging tends to bring gradual, predictable changes. Medical conditions often bring noticeable shifts, new symptoms, or worsening patterns. Your body rarely changes dramatically without a reason. When to take action, you should seek medical advice when a symptom appears suddenly, worsens steadily, interferes with daily life, or feels distinctly different from your usual baseline. Trust your instincts. You live in your body every day. If something feels off, it probably is. Advocating for yourself is not overreacting. It is protecting your health. Growing older does not mean accepting constant discomfort, confusion, weakness, or fear. While aging brings wisdom and experience, it should not automatically bring suffering. Your body communicates in signals. The goal is not to panic at every small change, but to recognize when something deserves attention. The earlier a problem is identified, the more options you usually have. And the more options you have, the more control you maintain over your independence and quality of life. If this message resonated with you, consider sharing it with someone who tends to dismiss their symptoms. Sometimes a reminder is all it takes to encourage someone to seek help sooner rather than later. Aging is natural. Ignoring warning signs is not. And taking action today could protect your tomorrow.